Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. Today, Baltimore's historic drop in gun violence. Mayor Brandon Scott joins Dr. Josh Sharfstein to talk about the city's tremendous efforts to curb gun violence, including a complete rethinking of how to approach the complex problem. Mayor Scott talks about an evolution of this public health strategy that's brought Baltimore's violent crime levels to an all-time low. Let's listen.
Mayor Brandon Scott, welcome to Public Health on Call. I'm so excited to have you here to talk about what's been happening on violence and homicide in Baltimore and how we got here. How are you?
I'm good, Dr. Sharfstein. I'm glad to be here. Thank you guys for having me.
So at first, I prepared all these numbers, and then I realized you're really the person who should tell the story. Where is Baltimore today? What kind of progress is the city making?
Well, Dr. Sharfstein, we have made tremendous progress around this longstanding public health challenge in Baltimore known as gun violence. No one knows that better than you, being a former health commissioner here in the city of Baltimore. As you and I are talking right now, Baltimore has 109 homicides. Wow, for me, that's 109 too many. That is down 30% from last year, which was one of the historic lows, second lowest on record for Baltimore. And when you think about what I'm saying to you is that Baltimore, as you and I are talking right now, has the fewest amount of homicides through this date of any year in recorded history. And we got here by understanding that we had to throw away the outdated ways of thinking and broken policies of the past and really focus in on how we could tackle this issue from a viewpoint, from all aspects of city government and community. Really a comprehensive approach, a public health-based approach. As you know, when I was a city council member and then city council president, I championed having Baltimore have a comprehensive strategy to dealing with gun violence. I passed a law that made that a requirement. It just so happens that I am the first mayor to have to implement said law. And in 2021, in mid to late 2021, I unveiled Baltimore's first ever comprehensive violence prevention.
So let's go back to 2021. You're unveiling this first violence prevention plan, a plan that you had been talking about, a plan where you were out there saying we need to take a different approach to gun violence. Talk about where the city was then and how that was received.
Well, when I first said it, following from 2015 through a few years ago, through 2022, we had all these years of consecutive years of 300 plus homicides, much like we had in the 80s and 90s. And folks were demanding that, it changes. When I came into office on December 8th, 2020, I was dealing with two public health crises, obviously the pandemic and gun violence. But when I walked out of a row house in East Baltimore, Dr. Sharfstein, and said that we were going to do this in a comprehensive way and that we were going to reduce homicides by 15% from one year to the next, people literally laughed at me in the media, in community, in boardrooms in Baltimore, because they said there's no way that was going to happen. And in particular, there was no way that was going to happen through the way that I was saying, that we would do focus deterrence, which is now GVRS, that we would focus on the flow of guns and gun traffickers, and we would do community violence intervention. We would do all of these things because people were still brainwashed to thinking that zero tolerance policing and just arresting anybody that lived in neighborhoods like I grew up in Park Heights just because they were breathing would make us safer, even though they know that we didn't become safer from doing that.
It was 8 straight years, I believe, of 300 plus homicides, and a lot of people lost hope during that process. You mentioned COVID, and I'll just say I remember vividly you're standing in front of the microphones and being asked, how come you were maintaining certain COVID restrictions in the city? And you said, because my public health commissioner is recommending them. That wasn't heard that much from different officials at that point, and Baltimore wound up doing quite well comparatively, relatively few deaths and much higher vaccination rates than other places that are similarly situated. And you've had a different relationship to public health than many other elected officials, and you brought that to gun violence.
Yeah, I have. As you know, I've had great relationships with folks in public health for a long time, starting with, as you know, Dr. Verhoeven that worked at Hopkins and really came into this work honestly because having lived here my whole life, understanding and knowing that we had all these different failed ways of dealing with these issues and we had all these approaches that didn't work and having lived it, right? Being on the downside of zero tolerance made me yearn to figure out a different way and learn. And I spent a lot of time, as you know, coming to City Hall first as an intern and then a staffer, learning from folks and being blessed to be in the rooms and being signed to go to these meetings with these public health folks that some people might have been just sending me there just because they needed a body there. And it literally me being able to take that and soak that in and that become a part of the fabric of who I am, someone that works through data and understanding a problem and being critical about how we analyze that problem because that's the only true way to get to the root of solving it. And I knew when I came into this position that I had to break that mold of folks who were going to just do whatever they had to do in 3 years to get them reelected in the fourth, but to do the things that needed to be done. As I said that first day, I will do the right thing, not the popular thing, each and every time, because that's what Baltimore deserved.
And so you come out with this anti-violence plan, and some people aren't taking it seriously. Some people are saying it's not going to work. Tell us about what was in that plan and what your vision for improving this longstanding challenge in the city was.
Yeah, first and most importantly, we were officially saying that gun violence was a public health issue and we had to have a public health approach to dealing with that issue. In fact, the law that I passed has our health commissioner as the lead of making sure that we have a public health approach. But then you think about the gamut of what the CVIP is, right? Obviously, everyone knows I'm a big proponent of focused deterrence. For us, that is GVRS, the Group Violence Reduction Strategy, because we know a very small percentage of the people who live in our neighborhoods are those who are most likely to be the victim or perpetrator of gun violence. And instead of just policing everybody in West Baltimore, East Baltimore, or South Baltimore, we will be focused on those individuals. So we started with a pilot in the Western District, which you know is zero point 0.7 square miles that was in 37,000 people that was accounting for a significant portion of our violence, like 15 to 16% of our violence. We started there. And how that works for the folks watching is that we identify these folks through data and our partners at UPenn and the police department and figure out exactly who these small groups of people are, whether they're folks that we can actually reach out to try to get them to change their life. And we do just that, using our more folks, partners, and other folks who go to these individuals where they are, Dr. Sharfstein, and give them a letter from me that says, I know who you are. I know what you do. We want you to change your life in order to stay alive for you and your family. But if you don't take the mandate to stop the things that are leading to violence, then we will remove you from law enforcement. Many people have taken us up on that, right? For example, through the period of GVRS that we have, and be reminded that they were talking about a small group of people who are the folks that are the people at risk of shooting or being shot. So the numbers are not going to be in the thousands. 322 people have accepted support from us. 94% of those, Dr. Sharfstein, have not been re-victimized, and 98% of them have not recidivated. And on the other hand, those who told us to kick rocks, 551 arrests has been led to that. But at the same time, we were putting historic investments into our CVI network, Safe Streets, We Are Us, all of those folks who are doing that great work throughout the city of Baltimore. We were also attacking the flow of guns into our city, whether it's going after gun traffickers. We sued Polymer 80, the nation's largest ghost gun company, and won and entered their business in Baltimore and Maryland. Just recently, we won the largest settlement against any gun store in this country's history against Hanover Armory for selling weapons and ghost guns and parts of ghost guns to people without ID or background checks. And we made those historic investments also into our schools and our rec centers and workforce development. And when you have the police focus on those who are committing these acts of violence, who are using the guns, turning those folks over to our partners in both the state's attorney's office and the U.S. attorney's office, and even our federal partners who work with us every day to hold them accountable, right? Based on the great work of our detectives and the great work that the attorneys do in their prosecutions, you're talking about a coalition of folks that is humming.
So many things are adding up to this success. I want to circle back to the group violence reduction strategy. I've heard rumors that you go to some of those meetings yourself.
I do.
And you are helping the team think through how to put in place resources for people at risk for being victimized or being aggressors. Could you share any examples of how that goes and what you're trying to do in those meetings?
Well, I think that, listen, once a staffer, always a staffer. So as someone who had to work in the previous version of this, I know, like, they know I know the work, right? So, but also, as you know, as a councilman, I also co-led one of the largest anti-violence movements in the city. So in my heart, I'm a Baltimore guy. I would rather be out in the street than inside City Hall any day of the week, right? Please get me out of City Hall every day. But I think it's also important for that team to see me, right? And I don't get to go all the time. And, I'm actually due for one here soon. But for them to see me direct and for me to be able to sit in that room with them and listen mostly, but when needed, chime in and say, oh, well, no, we can do this, or we can reach out to that person. There was a case where the person that came up, the best person to do the talking to that person was me, right? Like, that's the kind of thing that you need. And that's how you can also lead, by showing people that you care about, working with them directly and not just directing them what to do all the time.
And how do people respond when they get these letters or these calls from you and this opportunity to get out of harm's way?
I think that the best story I can tell you about one of the letters happened to me at my oldest son, Saron's basketball game last spring. I'm at the Under Armour house on Fayette Street, and a lot of the older kids that play basketball, they help out and come and watch the games. This young man is, in his teens or maybe early 20s, but in his teens, it looks like to me. And he comes up to me and says, Mr. Mayor, I got something I got to show you. And I said, what's up? And he's like, I'll be right back. And he runs and he comes back with his cell phone and he shows me a picture of the letter that he got in his notification from someone, one of our More Voice partners. And I looked at him and said, all right, you ready? You want us to help you? He says, oh, no, I'm good. I signed up for ROCA the day after I got the letter. So that, to me, nothing can beat that. And then we had a YAP graduation last year that I was at, and one of the young men said he had been involved in the life since he was 12 years old, and no one told him he could do any different until YAP knocked on his door. That's what we're talking about here, life-changing work. I actually heard recently from a reporter who heard from one of the folks at YAP that a police officer had given some guys out on a corner, the gentleman from YAP's number, and they called them, right? And then people came in. As you know from being here, that's not happening in 2007, 8, 9, 10 in Baltimore. We're talking about like life-changing work, but it also shows why you have to build system, stay committed to them, and really ignore the noise as you allow them to grow and be successful.
Ignore the noise. It took a little while for these initiatives to take shape, and you were under a lot of pressure to do other things. How did you handle that pressure?
Well, I love pressure, as you know. I'm an athlete at heart, so that's never going to be a problem for me. But I think it's also important to remember that for me, the pressure to go back to zero tolerance and all these other things, folks should have known that never was going to happen, because it's different for me, right? It's different when I was sat down in handcuffs 6 or 7 times as a teenager and in my early 20s just because I was living in Park Heights, right? Why would I ever go back to that when you understand someone who saw gun violence before I was 7 years old, right? Who lost friends, who saw people get shot, who was a victim of gun violence and being robbed and having a gun pointed to in my face, right? Why would I ever go back to things that I knew didn't work personally? But then also being an educated man and a student of history, I know that oftentimes, as I say, in the words of Jay-Z, also known as Sean Carter, women lie, men lie, numbers do not. Why would I go back to mass arrests, Dr. Sharfstein, if I know that 2004 we had 278 homicides and we arrested 91,000 people, but the year that we had the best numbers ever for Baltimore in 2011, we had 197 homicides and they only arrested 56,000, right? And why would I go back to something that I know did not work the first time, that led to us being sued, all this unconstitutionality with the police department, me having to inherit a consent decree? Why would I do that? Just because people some folks think off emotion and they want to feel safe versus being safe. Having the
Right.
police go out and round up a bunch of people who are just outside in black doesn't make them safer, right? It makes them feel safer, because it's never been about how many people the police department arrests in the city of Baltimore. It's been about who and for what. And the numbers now bear that out. Last year, we had 201 homicides, 201 too many. We are not celebrating, we're acknowledging progress and know we have a lot of work to do. But with that 201 homicides, a lot fewer than that 278 in 2004, we had 17,872 arrests. That's the way that I thought about that. Doing the right thing, even if it meant that people were mad at me, even if it meant I wouldn't get reelected, because that's what Baltimore deserved.
Well, you asked the city to trust you and to trust your strategy, and the city did, and it has really delivered results. I want to ask you about the police and trust, because it's no secret that Baltimore's had a big problem with police misconduct, and trust in the police has been a huge factor. How do you think about that in Baltimore today?
Yeah, I think that very simply, we've come a long way, but we have a long way to go. When you look at us in my first term actually recently getting out of some of our portions of the consent decree, when you look at like the complaints and the things going down, right? Complaints for BPD is going down as crime is going down. But at the same time, Dr. Sharfstein, the clearance rate for homicides has gone up. And I want to get you the actual latest number really quickly. For example, as you and I are talking today, BPD has a 62% homicide clearance rate. That is a reflection, yes, of the great detective work that our fabulous detectives do, that I think we have the best homicide detectives in the country. But it also shows that people are talking more. People are working with our police officers more because they feel the difference. And we do have a long way to go. But if you were to tell me, Brandon Scott, when I was 20 years old, that when I was 41, almost 42 years old, that the Baltimore Police Department would be a place where mayors from around the country and the previous presidential administration would be sending city after city, department after department to talk about how to improve community policing and improve their department and improve the way that they're doing, I would have laughed at you, right? It
Right.
was a joke. But that's where we are today, and it's still not good enough for us, and we're going to keep working. The commissioner and his team are doing a great job, and we're going to keep pushing.
Great. Just a couple final questions. One of them, you mentioned the federal partnership.
Yes.
How is that federal partnership, and how do you think about the federal government's role going forward?
Listen, I think that no matter what's happening with the folks on Pennsylvania Avenue, and we have the best congressional delegation in the United States Congress. We hope that they will still be able to deliver some of the support and services that they have. For example, our congressional delegation were the first group of people outside of folks that work for me in the city of Baltimore to buy in to our comprehensive violence prevention plan. They actually helped us start GVRS. When you think about that, we know that work is going to still be, that connection is still going to be there. However, we do understand that even though, for example, we had announced the moving of GVRS into the Southern a few months ago, our local special agent in charge, the FBI, was standing right there. Despite all the stuff that has been happening out of D.C., we work with our federal agents here in Baltimore on cases. We hope that work continues, but we just have to be mindful of what is happening and what we're seeing around the country. And then we hope, again, that the president and his team allows them to continue to work with us the way that they have, that helped us produce results that we've never seen in the city of Baltimore. But we have seen some cuts, not directly to the city, but the cuts for programs like Victim Connect and Survivors.org, or support those who were hurt by violent crime. LifeBridge Health, who's one of our big CVI partners, lost a $1.2 million grant for the Center for Hope. Greater Baybrook had a $2 million CVI grant canceled. And that's what we have to be concerned about.
Let me ask you this last question. Homicides down to absolutely historic lows and other violent crimes too, dropping considerably. In your own words, what does that mean for the city?
Dr. Sharfstein, throughout my lifetime, the number one thing that people both inside and outside of Baltimore have said about Baltimore that said what's holding Baltimore back is the reason why we can't succeed is because we cannot drive down homicides in Baltimore City. But when you see homicides be down, shootings be down significantly, carjackings, robberies, everything, but in particular that homicide number, right? What it does is unlocks the potential of our city because now folks are recognizing that we can tackle the tough challenges in Baltimore, that Baltimoreans don't necessarily need someone that comes from the outside of New York or wherever. We can handle our own issues. And we don't say that we solved this issue, but we've made this progress. And that shows people that we're committed to making sure that we're doing the right thing the right way, which is very important for me. But when you see that number come down, it's not a coincidence that that number starts to drop. And now you see this investment, $7 billion just being invested just in downtown Baltimore in the next few years. Places that are being redeveloped that folks thought would never be redeveloped, right? They're going to be new home ownership houses in Park Heights in my neighborhood are going to be coming out of the ground soon. Wherever I go, people say Baltimore is on the rise. People are saying that they understand that this city has this potential, and now they can see it because they're not just being clouded by this thing that's been hanging over our heads.
I remember when I was a health commissioner getting every text of a shooting and homicide and having months where there was a homicide every single day. And it was really hard to hear ourselves think when that was going on. And we realized it wasn't just the death, it was the trauma to the family, the community fear that caused, how that impacted kids' ability to do well in school, parents' ability to do well in their jobs, and just the incredible circles of pain and illness that really caused across the city. And we could imagine, because we know Baltimore, we could imagine that there would be a day when these numbers would really drop. And it has been your leadership that's made it happen. So thank you so much for joining our podcast, and thank you so much for everything you're doing for our city here, Mayor Scott.
Thank you. Thank you for that. But it's not about me. This is about we. But thank you. We as in Baltimore and Baltimoreans, those who are in government and external in the community, this is all of our progress that we've made together that we have to continue to make. But thank you very much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.